Hey there. Hello, doctors, medical students, others. Welcome to the Career Doctor Advanced Med live office hours where if you've got a challenge in your medical career in Australia, I'm here to help you out live on the stream. We also answer questions that have been posed on YouTube and other forums. And we go through a few other things that are happening um, around the sort of medical careers process in Australia at the moment. So I'm just going to check that I've uh, got all my channels linked in. I think someone was going to join on LinkedIn, so I'm just going to open that up in case that person wants to add a comment. I'll just silent that. Um, let's see. So we've got a couple of people who've joined already, so that's great. Let's just grab the chat. Uh, oop, where'd the chat go? How do I overlay that again? There we go. All right, so I've got the chat working. So we will pop into YouTube and have a look at what questions we might have there. I'll just line that up. So I thought I'd do a few things today. Um, so going back to, so we'll do some YouTube questions. But something else I've sort of been working on is the medical internship guide for 2026. So um, applications for internships in Australia will be opening fairly shortly. In fact, in a few days on the 6th of May. So I've put together my comprehensive guide again this year for 2025 for 2026 internships. So have a look through that. Some of the information will probably be updated in the next few weeks because um, some states are a little bit better organised in putting up their info. We might have a look through that, and hopefully we'll get a bit of a short video out of that, which we can put up on the channel as well. And then the other thing is that May, June is the time for all the surgical training applications, and I've been working with a bunch of clients as I normally do this year around that. And I just had a few thoughts about the. Okay, well, let's find that again. Been working on a post which is around the in the wrong Google account here. I've just realised. Working on a post which is around um the YU question in the multiple mini interview. So set training application interviews are done according to a multiple mini interview, not a traditional panel interview. So there is a bit of a difference there. So I thought we'd run through that. We might just create a video there for my clients, and then again, I'll probably end up putting that that up on YouTube at some point as well. But if you've got a question or a comment about the medical careers process, either working in Australia already or thinking about coming here from another country, want to get my feedback on anything, please put your question in the chat box that's either on Facebook or YouTube, which I'll get directly into my Restream software. I'll also keep an eye on LinkedIn to see if anyone's got a question there as well. So cool. Well, let's get into it. We might start with just looking at a few questions. Yeah. So we've got a few. Not that many. That's good. I think I might have covered off the the backlog from last time. Cool. So well, we might. They're all kind of. Well, we'll start with the most recent. Oh, sorry, the late the oldest. So a question from India. Professor in surgical oncology, keen to get a job in Australia as a professional to continue teaching or to work as a consultant general surgeon. Uh, Done some of the process, which is correct. The early bits of verifying with Epic and creating an AMP portfolio and preparing for the IELTS. Okay. So hi Ravi. So your question is about uh, okay. So with the specialist pathway, the AMC is not involved in checking your documents, logbooks, recency of practice, etc. Your next step is applying to RACS, the Royal Australasian Surgeons. I recommend going through my free course, my website, which will help you to know what to do next. And interestingly, and we might just see if I can find this. Raxology. Geez. Um, so there's been a bit of a update around specialist pathway assessment in Australia. And I'm not talking about the new expedited pathway here. I'm talking about something that came out the last week or so from the Royal Australasian College of Surgeons. So they had to contact the Medical Board of Australia and be open to the point that they had not been applying the appropriate standard for assessing specialist international medical graduates. Now, you've probably heard me say that the Royal Australasian College of Surgeons has the lowest rate of comparability assessment of all the colleges in Australia. It's about 58% of all applicants. And this probably goes away to explaining why that is, because they've been apparently been applying a higher standard than basically the standard is that of a graduate fellow. So they've actually now offered a free, basically no disadvantage new assessment to 215 specialist IMGs that may have been affected since that time. The other thing that they have not been doing adequately is also allowing people to apply for limited scope of practice, which may, be of relevance to someone like Dr. Ravi here, because they may not want to, may no longer feel like their scope of practice is complete general surgery, but might be more focused on oncological surgery, for example. So this will also have some ripple effects for other colleges to make sure that they're adhering to the right standard first, which I think probably most other colleges are. But this issue around limited scope of practice, I don't think it's been adopted as broadly as maybe it should have been. So I would expect off the back of this that that the process of applying for specialist pathway for a surgeon, or at least the outcomes of applying for that pathway for surgery, improves. Whether or not you can get a job or not will probably still be an issue, in particular, specialties like neurosurgery and cardiothoracics, for example. But one would expect that the rates of partial and substantial comparability from those assessments go up. So that's an interesting development, and it'll probably put other colleges on notice to make sure that they're doing the same. Again, we see high variabilities in the rates of assessments. We've got I will do a video on this at some point, but it goes from about 58% with the College of Surgeons over the last 9 years worth of data, to about 98% with the College of General Practice. So a 40% variance with all the other colleges somewhere in between those. Um, and yeah, it's unclear to me why there would be such variation if we're all applying this, if all colleges are applying the same sort of standard. Um, Cool. All right. So thanks for that question, Ravi. Yep, I replied to that. Yep. I might just see if we've got any questions here on the stream. Check on LinkedIn as well. You can add a comment to the video on LinkedIn. I just don't get automatically notified about that, so I have to check every now and then. Cool. All right. Well, we've only got two more YouTube questions. One from a Medixo 11 days ago. Hello, sir. Do I need my internship year before I come to Australia or to take AMC exam? And how many minimum years after my degree completion would it be take to be selected in racks? Please reply. I want to be a neurosurgeon in Australia. Okay. Well, you've picked possibly one of the most hardest paths, even for a local graduate. I do have a bunch of videos about internship in Australia. There's a series and a free course on the standard pathway, which is the one that you're referring to, which requires the AMC exams. Um, uh, so, hi, I'd recommend taking my standard pathway course from my website, which will clarify all questions. Um, you normally will need to have completed an internship if that's a requirement for full licensing in your country. You can sit for the AMC after you graduate from medical school. It normally takes local graduates several years to get to a competitive specialty such as neurosurgery. Good luck. And finally, we've got Daniel Ralph. Hello, sir. I'm from Pakistan. I will complete my MBBS in September from China. Can I apply for internship in Australia, and what will be the procedure? So, hi, I get this question a lot. Please see my other intern videos for reasons why this generally not available in OMGs. Cool. And I have got a intern This video explains why medical internship is really only applicable to Australian medical school graduates. Cool. All right. So those are all the questions. And just see again if you got a question. If you're watching on YouTube or Facebook or LinkedIn, and you've got a question or want to ask my opinion on anything, feel free to put something, comment in the chat. We can interact. So what we might do is let's do while we're on the theme of internship, let's now have a look at my guide. So we'll bring that up. Go there or there, maybe up here. So every year I produce a guide to the application for internships for that year, and it's always a bit of a challenge what to name this because people want to know about the 2025 internships when in fact what they really are applying for the internships in the year 2026. I think I've done about 6 of these now. There's quite a lot of effort that goes into it. I have streamlined it somewhat by basically now copying the previous years and updating it rather than just doing it all once again, and you'll see why that makes sense shortly. First thing is, if you do notice anything that changes or is incorrect, please get in contact with me so I can keep this as up to date as possible. One thing we'll talk about is that we're now getting some reports from some of the jurisdictions about that they make public in terms of the previous year's process, and how many people applied in which categories and who got jobs, etc. Been quite clear for a few years now that the jurisdictions are no longer filling up all their internship spots, which is interesting because when I was the medical director at HEDI, it was the opposite. And there was this thing called the internship crisis where medical graduates were concerned they wouldn't be able to get an internship. And in fact, the Commonwealth stepped in and provided some additional internships in private hospitals, which is still occurring, even though now the jurisdictions are unable to fill all their spots. And we have a few new medical schools coming down the pipeline, but probably we'll still have an under supply of graduates, I would think, into the future. The problem is that not every state produces a public report for me to actually add it all up. Now, that is an interesting development. And then the other thing is that, again, this has been hard for me to verify with every jurisdiction, but in my work through being the chair of pre-vocational accreditation with South Australia Medical Education and Training, I have been told that every jurisdiction has now moved to a 2-year contract or a minimum 2-year contract. In fact, you get longer in some jurisdictions like Western Australia. Although, again, I haven't been able to confirm that on every website. So, which is part of the move to a 2-year pre-vocational training framework, which if you think about it, makes sense that you give a contract for the full training period. It also, that's quite useful as well because, a small number of interns percentage-wise every year will struggle to complete their internship on time because there are various time-based requirements. So it's good that there's a 2-year contract so that they don't have to reapply for an internship just because they may have been, say, sick for a excessive period of time or took time off to have a child or something like that. So or struggled with a particular term. So I understand that you should. Sorry, Siri just talking to me there, guys. Which is interesting. I got a new phone and I can't get the SIRI to respond to me, but it just did then. Where I was like, yeah, so you should be getting a 2-year contract, I think. I haven't been able to confirm it everywhere. We've got all the dates here. So here are your key dates. dates for this year. This this part is much easier for me because there's a national process. So thankfully, I don't have to put the dates down for every jurisdiction. There was a point in time when there were different dates, so that was much more problematic. This makes it easier for applicants as well, particularly those who are applying for more than one jurisdiction. So applications will open on the 6th of May 2025. What's that? Tuesday. And they're going to close on the 5th of June 2025. And so this is normal. You get about a month to put in your application. I think I've got the key date. No, that's not right, is it? Because it's Friday the 2nd of May. So that must be either Monday the 5th of May or Tuesday the let me just check on that. Okay, so there's my first correction. So it's actually Monday Tuesday the 6th of May. So I'll just fix that up. All right, fix that one up. So the Tuesday, 6th of May, they open, and crucially, and this is correct, Thursday, 5th of June, closes. That is like, I would not be putting it in on the last day. I think technically you've got to like putting to Hetty at least 11:59 p.m. but I would not be leaving it that late. And there's always, every year there's somebody who forgets. Don't be that person. And then there's a bunch of stuff that happens. We'll sort of see it as we go through the states, but there's a bit of activity that happens after the application is closed in terms of things like interviews for the various special pathways, certain states like the Aboriginal pathways, the rural pathways, etc. And then your first round of offers, which again will be for the rural and Aboriginal and Torres Strait Islander type pathways, will be on the 14th of July with the main offers for the main metropolitan hospital type rounds on the Wednesday. And usually most people will get their offer by this time, like the majority, because most people will be in a high priority category. And then you can see here there's basically like a rounds of offers and a period of close, which allows the national audit process to check how it's all going and clear out people who might have more than one offer on the table to sort of free things up and make it sort of keep moving, basically. So they're your key dates. Here are the figures as we have them. Now, some of these, unfortunately, are basically based on the year before's numbers. So you can see these numbers in 2025, the same as these over here. If anyone, particularly from the jurisdictions of Western Australia, South Australia, Tasmania, or the ACT, is able to update me, I would be very grateful. You can comment below this post, or you can contact me in the help here, my email on my website, contact form, whatever. But we know that the numbers have gone up. At least what's that? Uh, by 111 again. New South Wales is now well over 1,000 interns. I was sort of thinking maybe Victoria might get to 1,000 by this year. They may still do if there's a bit of growth, but it probably will be the year after or the one after that. Queensland's actually catching up significantly, and you can see this sort of reflects that not every jurisdiction is the same in terms of the number of interns per population. The larger, the two largest states have the least number of interns per population. Now, why is that important? You know, there's other doctors, obviously, etc. Well, your interns become your residents, they become your trainees, they become your consultants. So if you're thinking about your future workforce and how many doctors you need, general practitioners, other specialists, having more interns in the system does kind of end up with more other doctors in the system. And you can see the Northern Territory, for example, has the more than double the number of interns per population than say New South Wales, and the Northern Territory is quite short in number of doctors per population overall. So that, it's a good strategy that they're really trying to up their number of spots. I'd be interested to know how many positions go unfilled. However, I've put the salaries there. You can see that New South Wales is now clearly lagging behind everywhere else, both in salaries and unfortunately other conditions as well. I've got another post that sort of highlights some of that stuff. So it's not surprising that there's a bit of industrial action going on in New South Wales at the moment, which is my state. We also know from the Hetty report that last year 42 posts were unfilled. Quite a large number in South Australia as well. And we don't know last year's for Victoria, but they do a report and they'll probably update this one. We know the year before there was 16. So hard to know what the total quantum was, but that's at least probably going to be 100, maybe 150. Which is interesting because we've got this program here, the Commonwealth program, which is meant to sort of provide additional capacity. Arguably, that capacity is no longer required. What it does mean is that potentially, hesitate here. um, uh, Potentially, there's more opportunities for international graduates to do internships, but bear in mind, and I'll put a link to my video about why you're unlikely to get an internship in Australia as an international medical graduate. It is quite difficult. But it also means that if those positions are not filled for internship, probably hospitals will start advertising for resident jobs, so PGY2, postgraduate year 2 jobs, for which IMGs may be able to apply for. So it probably means that there is a bit more capacity for particularly IMGs on the standard pathway as well as the competent authority pathway to get spots in the Australian system. So the numbers, New South Wales is looking at 1,175 for next year, Victoria 973, Queensland 921, Western Australia probably 401 based on the year before. Same with South Australia 353, Tasmania 106, Australian Capital Territory 96, Northern Territory 88 internships, and the Junior Doctor Training Program, the Commonwealth scheme, which kicks in later in the year, probably 115, although we will try and update these figures as further information comes forward, leading to a grand total of 4,228 internships for 2026. And then you've got your key dates, you've got a table of contents here, so you can kind of find your way to the various jurisdictions, um, including New South Wales, etc., which I won't go into in great detail. You'll see when we look at the New South Wales one, I give you, this is general for each of them, breakdown on the pathways, what the priority list is, and then links to the various the recruitment page so that you can um, find your way to that as well. Um, so that's the internship. I'll just see if there may be some questions about that. It doesn't look like it, but um, we'll do a short video on that. Cool. All right. So what else? So the last thing I've been sort of contemplating is as I said, I every year I have about 20 something trainee doctors who are applying for the College of Surgeons specialty interviews. If you're interested in working with me on that, I would encourage you to book the year before because I again, like all other years, sold out my spots fairly early this year, and it's actually important that you give yourself several months to apply. In any case, um, so uh, one thing that's a bit different from a college application process where they use a series of interview stations or panels, what's commonly referred to as the multiple mini interview, uh, which is also something they often use for um, entry into medical school, and it's kind of similar to an OSCE, except it's more of a interview for a spot rather than a interview about your knowledge and skills of the training process. Um, so generally, like you might have half a dozen stations. Sometimes it's three, sometimes it's six, sometimes it's maybe a couple more. For a lot of the set panels, it's about six. Others there's about three. When there's three, they call it a structured interview, but it's essentially a multiple minute interview still. And so what that means is that each station will have a bit of a focus, and you're not going to get the same questions in each station. You'll get different types of questions. You might get um, a station which is like a clinical scenario where you're asked how you would sort of work through a patient case. Um, you might get a station that's kind of a more of a clinical scenario, but there's kind of a professional, like an ethical issue or a management challenge or something like that, where the focus will be more about how you'd go about solving some of the other problems. You might get a station which is like you sit down and read an article, and the next station you have to kind of talk about what you learnt from the article. It can vary quite a bit. So you don't necessarily get a formal question like you do in the traditional panel 9 times out of 10, which is why have you applied for cardiothoracics, or what strengths do you bring to orthopedic surgery, or something like that. So your kind of yield for practicing the question is maybe a little bit lower, but if you go through the past question banks for things like set interviews, you'll notice that there are still a range of questions which are about your aptitude to work in the specialty, I guess. And so it's definitely worth still thinking about that and practicing because, um, colleges like the College of Surgeon will value highly things like your motivation and commitment, your understanding of the career, the pathway of training, whether you have insight into the demands of the training, whether your personal values and attributes align, etc., and having good self awareness. So because these questions are quite common, it's definitely worth practicing the why you question if you like, but you probably want to break it down a little bit further. So I've sort of broken this down. This is kind of the start of a post which needs a little bit more work. But essentially we've got one, two, yeah, four kind of broad questions that I would recommend that you practice for. Um, The first is questions around your interests, so your passion, why you love the specialty. So that might be what attracts you most to urology. Can you tell us when you first became interested in uh, ear, nose, and throat surgery, or why do you want to become a neurosurgeon, et cetera, et cetera. So for this, as you can see, I recommend that you do have an answer for that, and it should focus around what you like about the specialty, but also why that means it's a good fit for you. I'd recommend having at least 3 key points, which should be different areas of the specialty. Um, and then finally, once you've outlined those points, which would be your initial signpost, try to also then use that as an opportunity to talk about your entrustment, i.e., what skills and capabilities are you up to in those areas as well. So, as you can see, for example, if one of your points about cardiothoracics is that it's a good mix of surgery and acute medicine, talk about the types of acute surgeries and medical problems you've been dealing with so far and the most complex ones. Um, but that's you know, the actual why question, if you like, the question about your interest. Then we have questions about aptitude. So these are around your strengths or what you bring to the role. Um, and uh, this is probably like often the more like closest to the sort of traditional panel interview. So it might be, what strengths can you bring to pediatric surgery, or what have you done to establish that um, general surgery is the right specialty for you? So this is essentially the converse of the above questions. Again, I recommend having at least 3 key points. I would think about the CAMP framework and try to start with some clinical strengths, because it is, it is clinical medicine. Um, and the focus should be on what you've achieved against these points, your entrustment against. So, so for example, if we're talking about vascular surgery, perhaps, and your clinical strength is sorting out highly complex comorbid patients, then give a very brief example of the most complex case that you've sorted out, which specialties you involved, etc. recently. Um, and then towards the end of the answer, you've got time permitting, give a little bit about the why you love the specialty, which is kind of sort of flipping this one. Okay, the story there. Okay, so then we have questions about understanding the role, and these are kind of a bit of a mix. So there's, what do you understand about the training program? Obviously, it's not a good look if you don't understand the training program. Here, what I recommend you do first, though, before we outline the components, is talk about the why, not the what. So usually, if you go to the training handbook or the curriculum, there'll be some early statement about the purpose of the program, which will be along the lines of producing high quality whatevers who can do X, Y, Z. So it's good that you know what the outcome is, basically. You want to put that first, and then the what. And usually you can break that into the program stages. There's usually about 3 stages in most programs. Okay. Then there'll be, what do you feel, it's a question about challenges. Okay. So this is the weakness question in disguise, and this is a trap. So key points here is only ever give one challenge or weakness. Try and make it a challenge, unless pressed for a second one. You don't want to open up more than one sort of area for them to have doubt about your application. Now, it is an MMI, and they'll be scoring this particular question, so it's not as bad if you fail, do badly on this question as you might in a panel interview. If you do badly on this question in a panel interview, you generally will not get the job. But yeah, make it one challenge, unless definitely ask for more than one. And then try and make it that something part of the role that other trainees also tell you that they struggle with. So you're part of the herd. Okay, it's understandable rather than a personal weakness. And importantly, don't just outline what the challenge is, but what your plan for that challenge is. And if possible, give some examples of dealing with similar challenges in the past. Okay. Then we've got questions about demands and stresses. So, Cardiothoracics can be very demanding to train. How have you prepared for this? I really hate this question. It's probably the one question I hate the most, that I would never myself ask in a um, in any sort of interview, really, for a medical position. And the reason for that is that I don't think that a service or a college really has any right in asking this question anymore. I think those in power have had enough time to sort out the problems in the healthcare system that make training in whatever specialty stressful, or at least have made a bigger impact on that, and not to make it the problem of the trainee doctor anymore to deal with. Because trainee doctors have much less power and influence over these things. So by asking this question, you're shifting the responsibility away from your responsibility to an individual's responsibility. That being said, getting off my hobby horse, the question does get asked. And the way I would approach it is kind of what I call the micro to macro approach. So start off with the personal things that you do to make sure that you uh, ensure that you are healthy and well and fit to practice medicine and train. And there is a professional responsibility for all doctors to do that, to recognise that it's important to stay healthy and well to practice medicine, and do your own individual things around that. So we all know what some of those things are. But then shift it to teams. So what do you do within a team so that everyone's staying healthy and well? And how do you look after your team mates, and how do they look after, what do you expect from them, and how that sort of helps to balance things and make coming to work a joy rather than a stress. And then finally, what about it on a sort of organizational systems level? Um, what do you expect from the hospital, or what do you advocate for on a hospital level or college level? What should the hospitals and colleges be doing to make the actual job demands, training demands, less onerous over time? And this is where you may want to sort of think about recognizing some of the things that particular colleges may have tried to do already. So, for example, in orthopedics, I think, for example, they've tried to bring in a sort of a flexible training policy to help people, recognizing that many trainees doing surgical training are in their mid-30s at best, and they may have already started or be wanting to start a family and things like that. And so the rigors of more than full-time, 80 hours a week training are a bit hard for that. So, as I said, recognize what the colleges may be doing already in that space. So that's the demand question. And then finally, you may get a question about what you feel are the key aspects of insert whatever key role in that particular specialty. Now, here, if you're doing the RACS set interviews, you've got a cheat guide. You've got their professional skills curriculum and guide, which outlines the professional skills required for a surgeon. In this one, this is the curriculum and this is the guide. I would start with the guide. It's the most accessible and relevant to this interview, I think. And this is like basically the Care Meds framework, which, as I say to many people, is the best kept non-secret, if that makes sense, in medical HR. Because if you understand this framework, you understand where a lot of the selection criteria and questions you get at interview come from. So this guide gives the RACS version of what medical expertise looks like and what's important as shown in clinical decision making. I think if I do that, I might get 2 pages. No, maybe not. Or technical expertise or professionalism. And so if you can kind of remember some of this stuff and repeat it back, you're showing that you've sort of listened and learned. So, for example, professionalism is about having insight, changes practice based on insights and feedback, is ethical, and upholds ethical practice. respectful and culturally competent, maintains personal health and well-being. So there you can, that previous question, you can say this is is a responsibility. And then interestingly, ethical billing practices. So you might not think that when you're thinking professionalism, but if you were to, like, if they said what are the key aspects of professionalism for a orthopedic surgeon, and you use this 5-point framework, basically, you would probably be close to what they're looking for. So use the guide to your advantage. So that's questions about roles. I've got to finish that part of the post there, obviously. Um, Again, if you've got a question or comment about any of that stuff, feel free to put it in the chat. And then the final group is questions about the future of the specialty. So these are things like, where do you think the specialty is happening in 10 years? What will be the impact of some topical issue like artificial intelligence on the specialty? Here, do I have a framework for this? I think you should anticipate these questions. They do come up. I think the best way to prepare for this is to kind of be aware of some of the innovations. And again, try and be broad. No, don't just sort of focus in on where the actual surgery is heading, but think about how the specialty might change its practice. For example, subspecialization is becoming an issue in some of the surgical specialties. A lot more, a lot more of the practice is working towards more multidisciplinary teams. There's overlaps in scope of practice with lots of, non in well, uh, endoscopic or minimal invasive type surgeries and etc. happening, which tend to overlap with some of the physician and radiology specialties, etc. Um, uh, yeah, so kind of have a few broad points around that. Think about how that might impact, in the city versus say in a rural area where, um, you know, people want access to need access to a broad range of services in that particular specialty. And then, yeah, think about the topical questions. Have a look through the RAC's recent sort of news and outlines, and the society ones as well, and see what's coming up. And uh, at least have a few points to sort of discuss if you get something like artificial intelligence. Um, and try and make it a bit of a mini debate, positives and negatives. It's okay to have a view. Like today, I think your view is it's inevitable, um, but it comes with its opportunities and threats, I guess. Uh, and so that would be the way to handle those sort of particular questions. So, um, there are some of the kind of common questions around the why you question in the MMI. Hopefully, that'll help you with your practice. So with that, we haven't had any questions today, which is interesting. Normally we have a few. We have had some people joining us, which has been great and appreciated. I'm trying to do these regularly on Fridays. My schedule keeps mucking around with the time a little bit. I might at some point move this to the afternoon, maybe potentially to make it more regular. I think I will be here again next Friday at this time. Thanks for joining me today. And hope you learned something. And I will see you